I'm a doctor.
Me too.
And I don't get pap smears anymore.
Why not?
I know that sounds crazy to some people, but hear me out.
Since she's leading with being a doctor, I want to know what kind of doctor she is, and if it ever takes more than a couple seconds to figure it out, it makes my spidey senses tingle. The most I could find were these credentials, and when I Googled them, I couldn't even figure out what they were, so I'm actually not even sure what kind of doctor she is. And that's relevant because now she's telling you basically not to get a pap smear.
Pap smears are used to detect abnormal cervical cells, but here's what they do not tell you. 1, there are many false positives. 2, that leads to unnecessary biopsies.
Those are really
And 3, it does not address why those cells are changing.
It's not supposed to.
There is no root cause treatment.
I don't know where we got this idea that diagnosis and treatment need to be like a combined thing. Sometimes diagnostic tools like a pap smear are just to diagnose things. There is no promise of a treatment with a pap smear.
So here's what I do instead. I run and order and interpret properly a lot of different labs.
So you run a whole bunch of different tests instead of the one test that has been validated for cervical cancer screening. And my guess is that insurance doesn't cover those. Oh, look, I was right.
I test for high-risk HPV, which is a real trigger. I also monitor with thermology as well as functional testing. And then I support my body's natural drainage system.
I'll give her that because HPV testing is what we also do with a traditional Pap test. If you're over the age of 30, we're getting both cells and HPV testing. If you're under 30, it just depends on your results of the cells. The thing with cervical cancer is that until there's a big bulky tumor, you're really not going to see a lot of the issues with cervical cancer. That's why we're looking directly at the cells or the tissue when we take those little biopsies that she also is fear-mongering.
I don't live in fear of cancer or any other illness. I live rooted in wisdom, prevention, and truth.
But you didn't even talk about the prevention of HPV. You didn't talk about the Gardasil vaccine or even things like a barrier method when you're with partners. Instead, you sold your $1,000 consults, which have no evidence behind them, and fear-mongered the mean, cold gynecology office for the one validated tool we have for cervical cancer screening.